AI-powered tools can help manage your health, when to use them, and when it's potentially harmful. To do that, we are joined by family physician Dr. Vera Kohut. Great to have you on, doctor.
Thank you. Thank you for having me.
Should we start with the good news? I think we should.
Yeah,
Let's start with the good news. So what sort of things can AI help patients with?
So AI can help with things like taking a symptom and asking about it. It can help with things like making medical information more usable. You know, you get a result, you look at it, and it's medical jargon, right? It doesn't make any sense. So you can ask AI to translate it and make it layman's language. Same with things like blood results. You get them and you don't know, you know it's red, you know it's black, but you don't know what it means. It can be used as the chatbots can be used. They can be used to remind you to book an appointment. They can be used to help you track your blood sugars. It might be even really useful to get some general information on just wellness, well-being.
Yeah. You can have conversations.
Yeah,
really.
yeah, it'll talk to you.
It'll talk to you. So what about what AI can't or shouldn't be used for?
So AI, if you think about it, is a machine that has been given information and then it gathers information from all of its interactions. So it's not nuanced, it's not personal. It doesn't really, it's not looking at you, it's not listening to you. It's not in an environment where you're with a provider that's actually paying attention to what you're saying, what your body language is like. It doesn't have all of that information. So it's simply taking information from a block of data and pushing it in, and so therefore understand that it's not going to be necessarily about you. It also, if you ask a question, it may not be able to answer it properly, so it may hallucinate. It may give you kind of an answer, but it may not be accurate, it may be overgeneralized. Important to understand that as well. And finally, it's a product. And what it does is that it's the first step. I always say it's a first step to you self-diagnosing, but it is not the end result. It's not replacing your primary care provider that's going to be able to actually diagnose, look at the conversation, put it together, make a diagnosis, look at the lab results, or even bring in specialty consults. So it's not doing any of that.
I think about, we talk so much about how so many people in this country do not have a primary care provider. They don't have access to a family doctor. Could this help in that respect too?
Yes, it is. You know, when you think about the fact that it's available 24/7, right? You can just go on there. So you can ask it about a symptom and it can be helpful. Or, for example, if you have a condition, you know you already have a condition and you want to know a little bit more about it, it can be very useful for that as well. It can be valuable because it is a first place to resource something that you might then want to go further and get some help with.
It's a tool.
It's a tool.
It's a tool. So what about red flags when it comes to AI? What stands out for you?
So if AI starts to give you a diagnosis that's a single, like one thing, that's it. It's all it is. And I go, no, it's not quite right. What about if it starts to say information that doesn't quite make a lot of sense? So it might be making it up. And it does, because if you ask it a general question and it can't really zone in with all of the information, it'll say things, well, more research is needed, or it frankly will just make something up. If it's giving you information that intrinsically doesn't make sense with what you're asking a question, or if it's not recognizing that you have a symptom and you're talking about something and it's escalating and it doesn't appreciate that there's a risk there, then beware.
Should I be concerned about entering sort of my personal health information into this?
By all means. Okay, look, that information that you enter in, it's going out into ether. Okay, so be aware of not putting out information that's overly personal. It's not private. It doesn't have that. It's not your doctor's office where the record is locked under key. Okay, it's out there.
So be aware of that. Thanks for walking us through this morning, doctor. Great to have you on.
Thanks, it was great.